We're joined now by Dr. Lisa Lee and Bruce Jennings, and we're going to be speaking about the ethics rules for public health. Dr. Lee, can you tell me a little bit about the benefits of having those rules explicitly stated?
Great, thank you so much. Yes, I think most people come to public health from a variety of disciplines, whether it is an anthropologist, a physician, a social scientist, a microbiologist, and each of those disciplines has their own sense of why they are there and what their science and technology is about, what they care about. Public health also, as a field, has a set of things that we care about, values and ways in which we do our business. It's very important in a multidisciplinary field like public health for us to actually state what it is we value, why it is we do the things we do, and what we base our decisions on in terms of the ethical answers to those questions where we're not sure exactly what we should do. We know a lot about what we can do. We really need to write down and share together as a community of professionals how we should determine what we should do.
And Bruce, can you tell me a little bit about what a code of ethics accomplishes when it comes to public health?
Yes, a code of ethics is quite common in virtually all professions. In fact, professions are thought of as occupations that are special in part because they pay attention to ethical values and goals. In public health, the code of ethics is a statement to us ourselves in the field, but also a statement to the society and community at large. What kind of business are we in? The code of ethics says, well, we're not exactly in a business. We're in a profession of public service. We've been entrusted with knowledge and education. We're entrusted with authority to tell people what to do in certain circumstances. And with that trust comes an ethical commitment not to abuse it, to live up to it, and to promote the health and well-being of everyone.
And Dr. Lee, can you tell me a little bit about how ethics is currently being taught in various schools of public health?
That's a great question. Most schools of public health touch somewhere on ethics, somewhere in their curriculum. We did an analysis a few years ago that looked at all programs in schools of public health, and about half of them have some explicit course related to ethics and ethical decision making. That said, the other half probably has this infused across the curriculum in some places. Our hope is that with the new Public Health Code of Ethics, this serves as an anchor for public health schools and programs to really think carefully about the importance of not only teaching public health students how to be public health professionals from a technical or a methodologic perspective, but also from an ethical perspective.
And so, Bruce, if somebody wants to get involved in helping to shape the ethics for public health, how can they get involved?
Well, right now, we're on the verge of having a lot more opportunities along those lines, I think, because the first step is to write and articulate as clearly as we could a code of ethics, a written document. And we have that now. But a written document alone will not change or increase the ethical capacity of the public health profession. What we need to do is now we need to work on the culture of the profession, the self-consciousness of the profession, so that we all recognize when important ethical value questions are at stake in what we do. Public health sometimes thinks that scientific data and facts alone determine what the decision should be. When that's true, that's very good. But a lot of times, increasingly now, when we're not dealing with just infectious disease or sewer systems, we're dealing with complicated behaviors. We really have value conflicts, and we need to know how to navigate those as public health professionals, not just for our own benefit, but our programs won't be effective if we don't. So we're going to have training programs and sessions, I hope, in many public health agencies around the country, not only in the schools of public health, but sort of in-service training after you're already on the job. It's a continuing educational challenge.
And it is a very important and complicated topic to deal with, and we sure do appreciate both of you joining us today to have this conversation.
Thank you.
Thank you.
Real pleasure.